or some patients' expectations are sky high, which you can't really deliver the goods. So turmeric in any form is fantastic. If you're non-veg, you have to decide how to balance your diet. But sun is a very strong element from the pigmentation. I see hardly few patients with skin cancer in India. अगर fair skin है और sensitive skin है, तो the most important thing they should do is sun protection. Not only the female, the male also.
Right. नमस्कार, मैं हूं मणि और आप देख रहे हैं द न्यू इंडियंस। आज का एपिसोड बहुत ही खास है क्योंकि आज हम बात करेंगे सेलिब्रिटी स्किन सीक्रेट्स के बारे में और स्किन ट्रीटमेंट्स के बारे में। और इस पे चर्चा करने के लिए हमारे पास है आज एक बहुत ही देश भर की जानी मानी हस्ती, द फेमस डर्मेटोलॉजिस्ट डॉक्टर रवि जोशी। So thank you sir for being here today and I welcome you here.
It's my pleasure and thank you very much for having me.
Thank you sir. So sir, पहले स्किन का ख्याल रखना क्यों ज़रूरी है और ऐसी कौन सी इम्पॉर्टेंट बातें हैं जो ये करते समय हमें ध्यान में रखनी चाहिए?
स्किन इसलिए इम्पॉर्टेंट है कि ये जो है दिस इज़ द बिगेस्ट ऑर्गन इन आवर बॉडी। अगर हम पूरे सिस्टम्स को जब देखते हैं तो स्किन बिकम्स द लार्जेस्ट। तो इतना लार्जेस्ट होने की वजह से ऑब्वियसली इट हैज़ कैन बी अटैक्ड बाय डिफरेंट वेज. It can be attacked by infections, it can be attacked by the sun, for example, and once you expose too much to various other seasonal variations, they get all affected. And जरूरी इसलिए है because aesthetic part of it. अगर skin अच्छी नहीं है, your self-esteem goes down, you feel low, तुम्हारी performance भी गलत हो जाएगी, you are not really feeling that easy going in this society. So I think skin has taken now the front seat rather than the back seat, which it used to be at one time, and people pay a lot of attention to it. Not only the female, the male also.
Right. Nowadays, male skincare has also become a hype now.
Absolutely. As I'm saying, at one stage, we used to get only females. The ratio used to be, for example, 80 to 20. But nowadays, I am not hesitant to say it has come down to 50-50 or maybe 60-40.
Definitely.
So they are coming forward because the girls are getting more smarter and boys want to catch up.
Right. So जैसे आपने मौसम चेंज की बात करी तो सर्दियों और गर्मियों में स्किन की केयर में क्या डिफरेंस आ जाता है और कौन सी ऐसी इम्पोर्टेंट बातें हैं जो हमें सर्दियों और गर्मियों में याद रखनी चाहिए कि मौसम बदल रहा है?
Let's start with गर्मी.
Right.
गर्मी में क्या होगा कि हमारे जितने ग्लैंड्स हैं बॉडी के दे आर ओवर एक्टिव.
ओके.
जब ओवर एक्टिव होंगे तो उनका स्क्रीशन भी ज़्यादा होगा. तो इफ़ समबडी इज़ गोइंग आउट टू मच इन द सन और दे एक्सपोज टू वेरियस इवन गोइंग टू द बीच फॉर एग्जाम्पल और वर्किंग ऑन द बिल्डिंग साइट or maybe expose the salespeople. So they expose too much to the sun. So they are likely to get, for example, miliaria, which is a sweat rash, for example, or sunburn. Okay. They are likely to get the skin is too much wet at that stage. So more likely to get infections. So in other words, we see more and more fungus infection. We see more and more bacterial infections. So in other words, the infection rate goes up in the wet area or in the summerish area. On the other hand, if you're talking about the winter, our whole glands shrink. So they are not that active. So your skin become more dry.
Right.
So dry skin invites more eczematous dermatitis. Eczema is very common in the wintry weather. And that makes you itch and that goes for many other things with it. So I think the main difference is in summer and this thing is the secretion of the various glands activity in our body.
Right. So कुछ ऐसी बात है जो हमें मतलब इन जनरल लोगों को याद रखनी चाहिए कि गर्मियों में ये नहीं करना है स्किन के साथ, सर्दियों में ये नहीं करना है स्किन के साथ?
Definitely in the summer, sun lotion is number one to apply.
Okay.
Because the sun is too strong. And as a result, if we don't protect ourselves, you are likely to get the effect of the sun and that has got more damaging effect on us. Number two, winter के अंदर, because the skin is dry, so they must use more moisturizers than normal to moisturize their skin.
Okay.
And that helps a lot.
सो सर जैसे आपने बोला दैट सन प्रोटेक्शन और सनस्क्रीन इज़ अ मस्ट, तो आजकल हम देख रहे हैं मार्केट में इतनी तरह की सनस्क्रीन आ रही है, यूवी, पी ए प्लस प्लस, पी ए प्लस 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 प्लस, या SPF 50 70 भी आने लगा है आजकल. सो हाउ डू पीपल चूज द राइट सनस्क्रीन?
Number one, the sunscreen has to be decided on the type of skin somebody has got.
Okay.
If you have got a oily skin and you decide for a sun lotion which is making you more oily, don't use that.
You have to go
So
to the
you have
water
to
base.
you have to go with the water base.
Okay.
Number two, if somebody is already reacting to the sun and has got certain skin diseases in which we don't advise to use more or less chemical based sun lotions, so we rather suggest to use mineral base like zinc, for example.
Okay.
Not chemicals with it, so they respond much better. So the main decision is obviously that why we are using it. Are we using it just a protection, which is obviously one can use any 30 to 50 is generally on an average that what we use. Less than 30, though scientifically may be good, but people do not feel happy with it.
Yes.
So you have
definitely.
to satisfy the patient's mindset also. So in our patient especially, we always go for SPF, which is a sun protecting factor, which is between 30 to 50. More than 50 is not recommended by WHO.
Okay.
So what they do, if you must have seen, they say 50 plus. So don't mention whether it is 60, 70, 65 or 85. Nowadays, there are certain, obviously, companies started writing, as you said, 70.
Right.
But this is not recommendable. And the best thing is to say 50 plus or 30 plus. And I think they are good enough to go ahead with it and use it.
And what does this plus means? Any specific?
Yes, that obviously they want to emphasize.
Okay.
Then we say plus, that means it has got a more SPF.
Right. The
They don't-
satisfaction thing you
It
said.
is just a psychological satisfaction to the patients. But nowadays, there are certain sun lotions have come which not only protect from the UVA and UVB, rather they protect you from the ultraviolet lights also. They want to protect you from the LCD lamps when they are exposed too much on you, or blue light for that matter. So in other words, there are certain sun lotions we recommend in those conditions who are very sensitive to the light. So this kind of thing you have to decide which patients need which one.
ओके. सो सर जैसे हम जानते हैं कि एक्ने या बढ़ती उम्र की जो निशानियां होती हैं, फाइन लाइंस, रिंकल्स, तो आजकल इसमें बहुत ज़्यादा एडवांस ट्रीटमेंट आ गए हैं. सो व्हाट डू यू सजेस्ट ऑन दिस? क्या लोगों को वो कराने चाहिए, या इज इट डर्मेटोलॉजिकली नीडेड, या इट्स जस्ट अ सोशल सिंबल कि ओके आई हैव डन दिस थिंग डन?
I think it is both ways.
बोथ वेज.
There are certain skin diseases which makes your skin lax. Okay? So in those circumstances, we ourselves recommend, look, you want to have a better skin, so that's what you have to do. But most of the time, it is the patient's wish that they feel their skin is sagging. They feel they are wrinkling. They feel they are aging faster than what their age is. So in other words, you have to go along with the mindset of the patient, what they actually need, and then you decide and tell them and explain them that far you can do. Nobody can make you teenager if you are in your 50s or 60s. But on the other hand, definitely you can make your skin look better, shiny, and obviously many patients come for the pigmentation in our culture, that what we are. So you have to take care about their pigmentations and all sorts of things, and go according to the wish of the patient.
So, are these chemical peels and laser treatments really safe for the skin, और ये किन लोगों को recommended है? Like any specific age limit कि okay you should be over 20 or over 30 to do these, या ये कोई भी करा सकता है? What do you think about it?
We don't do it in the children.
Okay. Children as
But
in
on
below
the
18?
Naturally 16 to 18 is below.
Okay.
So once they are even eligible for voting, so that means they are grown up.
Right.
They can take their decision. So I personally respect the patients whom we trust in our society, that they can choose their government, they can vote. So why not? They can decide even for their face or for the body also. As you said, the chemical peels and many things are available nowadays, which improves the wrinkling, that improves the texture of your skin, that obviously takes the wrinkling on your neck, on the face, on the eyes, on the
Right,
forehead.
right.
So in other words, we have got many things available aesthetically to satisfy the patients.
तो ये लाइक केमिकल पील्स एक नॉर्मल ह्यूमन बीइंग लाइक अ पर्सन लाइक मी कितनी बार करा सकता है ऑन अ सेफ लिमिट?
Number one, the number depends on the condition why the patient wants to have it.
ओके.
If somebody wants to have just rejuvenating, to have just a better face or glowing, then I think once in 3 months, 6 months, whenever you feel you are low, or there is a function in the family or in the friend circle, then we do it.
ओके.
So one can come and get it done because they are safer.
राइट.
Nowadays, what we use is not causing any damage to the skin, rather they make your skin even better. So days are changing, the preparations are changing, and obviously you see the patient's limit in many ways, whether it is the age factors, whether it's the disease factor, or some patients' expectations are sky high, which you can't really deliver the goods. So in those sort of circumstances, I think you have to bring the expectations to a realistic level where patient feel happy end of the day and you feel happy as well.
राइट. तो इसी के साथ ना आई हैव सीन अ लॉट ऑफ पीपल हु ट्रस्ट ऑन होम रेमेडीज कि बेसन लगा ले, हल्दी लगा लेते हैं, यू नो टमाटर को काट के दे रब इट, दे यूज बनाना पील्स. सो आर दे ऑल्सो गुड फॉर द स्किन और दे कॉज डैमेज और हमें उनसे बचना चाहिए?
Number one, these home remedies, personally, I don't say don't do it. Generally, if they are feel happier, that is working. Okay, but on the other hand, these remedies we are using in our practice also. Now you got a fruit peels.
राइट.
You have got many other preparations which are extracted from all these phyto, we call them a phyto extracted, from the plants extracted, from the fruit extracted. So they are more refined and we know what percentage results they can give. On the other hand, the same thing if you are using at home, I personally think why not? As long as patients feel happier that it's working. But on the other hand, if you feel after using certain, that also we see.
राइट.
They you use many remedies at home and they react.
यस,
So they
एग्जैक्टली.
develop reactions on their skin. It swell up, it becomes red, inflamed, acne comes up because they try certain home remedies thing. So we have to stop them and do the treatment that we like them to have.
राइट. तो सर जैसे हम जानते हैं कि आजकल जो बेबीज़ का स्किन केयर है वो भी मेल्स के साथ, जैसे आपने बोला, काफ़ी ट्रेंड में आ गया है. आजकल मदर्स अपने 6 मंथ्स 12 मंथ्स की बेबीज़ को लेकर आती हैं दैट व्हाट शुड वी डू टू द किड. तो क्या उतने उम्र के बच्चों को स्किन केयर की ज़रूरत है या उनकी स्किन सेल्फ सफिशिएंट होती है, और बच्चों को कब से स्किन केयर या SPF लगाना चाहिए?
Number one, generally we do not see young babies from the aesthetical point of view.
राइट.
Mother, don't bring that my child want to be beautiful or we have a pigmentations or hair and that. We don't see them.
राइट.
So what we see, obviously, the babies borrow the hormones from the mother when they are born. So those hormones are not baby's original thing. They are borrowed one. But then they have got an effect on their skin.
राइट.
And they have got effect on their hair also. They have got effect in different ways on them. So in those circumstances, they develop certain skin diseases. And that's the way mother brings to us, whether it is the too much scaling, cradle cap, causing eczema on their scalp, or they got eczema on their body, or they got too dry skin or too oily skin.
Right.
That's one way of seeing the babies. The second reason what we see is the nappy rashes. That obviously mother would start using nappies to the babies, and the nappies obviously cause reactions. And also we see the babies because of the urinary touch to the skin, the bowels. So in other words, they develop problem that is called a ammonical dermatitis, fungal infections, or too much, even the intertrigo. That means the folds get inflamed,
Right.
and the wrong applications mother may be using it, that causing a problem to the babies. So generally we see the babies with a real problem with them, so that
Okay.
have to sort out, but not to improve aesthetically. As you asked me about the sun lotions, for example, when they protect,
Right.
so generally speaking, my advice personally is that if you are little bit, is important for the babies to be exposed to the sun so that they develop vitamin D3.
Right.
If they are really locking them up in the room altogether, they'll be deficient. Their bones will be weak. The skin will be weak. So, in other words, that the way our old fashioned dadima used to do it, massage and then
Massage
expose to
oil,
the sun.
yeah.
तो अगर ऐसा करते हैं तो baby skin get healthier. Their whole activity becomes, they are more active also. And also the bones get vitamin D3 to be strong. So that is no harm in it. But on the other hand, to cover them completely with the sun lotion probably is not a good idea unless and until patient has got a photosensitivity. That means their skin react to the sun.
Okay.
So in those circumstances, you have to protect from the sun so that baby doesn't get any reactions because of the exposure. But otherwise, you can apply on the face so that the face doesn't get darker. In our we are very concerned about the
Exactly.
pigmentation. Patient can use these sun protections on the arms or hands, but not to
Not on
smither
the.
on the whole body.
Right.
And not let the sun have got any effect on you.
So like we were talking about home remedies and now we are talking about किड्स को कैसे ध्यान में रखें जो पहले के नुस्खे होते थे दादी माओं के या नानियों के टू रब आटा एंड बट टर्मरिक हल्दी आटा का लेप लगा के दे यूज टू रब इट टू रिमूव द फेशियल हेयर कि आगे जाके इट विल नॉट कॉज अ प्रॉब्लम सो इज दैट डर्मेटोलॉजिकली सेफ क्या हमें वो करना चाहिए या इट्स जस्ट हार्मिंग द स्किन बैरियर
No, I think turmeric is the best decongestant and anti-inflammatory, antibacterial, antifungal.
ओके
So turmeric in any form is fantastic. And that is why we are getting nowadays curcumin capsules, we are getting curcumin creams, we are getting curcumin is wonderful stuff. So Dalima was not wrong. So when you apply it on your skin for a while,
Right.
and don't be too harsh to the skin.
Yeah, that's what
But
I'm
if
asking. जो ऐसे करके नहीं वो लोई को
harshness
लगाते
is bad because then you are developing a frictional dermatitis. That's a different thing. But to apply it on the skin and then wash off has got no adverse effect. It's not a barrier. It's not something you should not do it. So I think turmeric is wonderful stuff. And depending on the concentration, obviously, too much concentration sometimes to the young babies may not be a good idea. But on the other hand, they are very good decongestant.
तो सर जैसे हम सुनने में आता है कि इफ़ यू वांट अ ग्लोइंग स्किन यू शुड आल्सो टेक केयर ऑफ द फूड यू आर ईटिंग आपको खाने पे बहुत ध्यान देना चाहिए सो इज़ इट एक्चुअली ट्रू और कौन कौन सा ऐसा खाना है या क्या हम ऐसा खा सकते हैं जो हमारी स्किन नेचुरली प्रोटेक्टेड रहे और हमें कोई प्रॉब्लम ना हो
Number one, there is never got one thing that you take this thing and then your skin will glow and you'll be healthy. Rather, you'll be deficient for other things in your life. Don't do that.
ओके
So patients do, or the mothers when they come, they emphasize, as you said, which one should eat. My personal views are the nature gives you different things in a different part of the year. And they are different and they have got a different nutrients.
राइट
So in other words, whatever available with the season is the best thing to go for. Even to make smoothie for the children, to smoothie for the young ones. That has got everything in it. Mixed fruit I give. I ask the children to get it, for example, beetroot milado, orange milado, apple milado. I'm just saying,
Right.
pomegranate milado, so that they have got all the nutrients that our healthy skin needs. Rather than we are giving too much medically. Take this syrup, that takes. If you need to give, we give it. I'm not saying I don't give it. Like vitamins, different syrup, if the child is growing and if you give some vitamins, there's no harm in it. But on the other hand, fruit wise or vegetable wise, one should really be more on the balanced sort of diet. But don't fix your mindset to certain foods thinking they are the best. And you deprive the babies or the themselves from other things which you need them, because no fruit is 100% sufficient in itself. So, in other words, answer to your question is that one should really rely on the natural availability, try to adjust according to your diet habits, and vary your fruit diets, and I think that will be helpful.
Balanced diet is the key.
Balanced diet is the only main thing to remember. But we know that vitamin C, I'm just saying in general, vitamin C in any form give you more protection. It's immunity. So that's why lemon and this sort of thing is very common in our
Orange,
diets.
yeah.
Oranges are very common. Amla, for example, is very good. So similarly, dry fruits have got all the things, whether it's an iron or other things, is wonderful. If you're non-veg, veg, you have to decide how to balance your diet. So in other words, one should eat unless and until there is a disease going on. Like many a time if the babies have got a eczema, we try to stop their dairy milk products in any form. Generally, if they are got atopic eczema, which is an allergic type of eczema, because these children they react to that kind of dairy milk. But then obviously we do certain tests also to find out, okay, have they got any problem.
So sir, talking about skin, I feel skin के साथ hair भी आजकल जो आपने बोला एक बहुत aesthetically pleasing कैटेगरी में आ जाता है.
Indeed.
तो हेयर फॉल की प्रॉब्लम क्यों होती है, कुछ स्पेसिफिक रीजन उसका, और इस प्रॉब्लम से हम कैसे बच सकते हैं? बिकॉज टीनेजर्स नाउडेज आर रियली फेसिंग अ लॉट ऑफ प्रॉब्लम कि उनको बहुत हेयर फॉल प्रॉब्लम हो रही है. सो एनी सजेशन?
सबसे पहले यू आस्क्ड मी द क्यों होते हैं ये. The major reason for the hair fall is the inherited effect of a certain hormones. So genetic factor is very important.
Okay.
So gene से related है. There is something called alpha reductase enzyme, okay, which obviously convert your testosterone into DHT. And that attacks the hair follicle, जिसकी वजह से ये मेल पैटर्न जो या फीमेल पैटर्न होता है इसी रीजन से होता है, which is the commonest alopecia that what we see, and this is called alopecia androgenetica. तो जीन्स का भी रोल हुआ एंड हार्मोन्स का भी रोल है. अपार्ट फ्रॉम दिस, obviously you can't stop it because it's an inherited one.
Okay.
But there are some contributory factor, the exogenous factor from the outside. वो क्या क्या हैं? The stress itself. Nowadays everybody is under stress some reason or the other. Number two, the environment you are living in, like hard water for example. Certain areas have got a very hard water and they realize they have moved from one place to another and they started losing the hair, and that may be the reason. And the third thing is their lifestyle. They are sleeping 3 o'clock early morning and waking up 2 o'clock in the afternoon. In other words, the whole system of your body is changed, and that affects you metabolically, that affects you psychologically, and that affects disturbs your day-to-day life also.
Right.
We are seeing more and more patients with alopecia, IT sector. क्यों? Because they stress so much whole day, they are really concentrating on the computer. And that stress itself may be playing a role. This is my guesswork because I am seeing a load. When I see certain patients, I ask them, what do you do? So I won't be surprised that they say, we work in IT. Another thing, those who work in a call center, They develop alopecia quite often because their whole setup is different. They work at night and they sleep during the day.
Right.
So they obviously get more hair loss than others. Apart from that, because of the stress, as I mentioned, you develop another kind of alopecia which is quite common. It's called alopecia areata. And in that one, you get patches of hair loss. You can get one patch or you can lose the whole hair. You can lose the whole body hair. So this alopecia areata can start as a one patch and then it can lead to what we call alopecia universalis. That means the whole body hair they disappear. So this is obviously is more to do, it's an autoimmune process in your system which get disturbed because of your stressful personality that you carry, or something goes wrong in the job or at home or studies, or you become too much ambitious and planning. Some people are more planner than others, but that affects your health also. So that is why it could be a nutritional, it could be a infective, like fungal infection can cause you. So in other words, there are certain diseases that what we are seeing more, again called cicatricial alopecia. That means these diseases become scar in your scalp. So when you become a scar, your hair follicle, after where the hair grow, they go from the seed.
Right.
It's called hair follicle. And if the disease destroy those hair follicles, then where will you get your hair back? So we can't help them. We have to tell them, unfortunately, that the sooner you come, you can stop the disease. You can halt the process. But if the process has taken its course and you see the end result, then unfortunately, the present available medications are not sufficient. Only thing what we can do for those kind of patients who develop a scarring or AGA, as I told you, or some other thing, is the hair transplant. That you can take some hair when the disease is quiescent, is in a remission, and it's not inactive. Then you can take some hair from certain part of your body and then put those patches, and so that you can fill them up. So you do your best, whatever you can do, but in the scarring type of alopecia, unfortunately, you can't.
राइट सो आई फील आपकी बात सुनने का मुझे लग रहा है कि लाइफस्टाइल प्लेज अ वेरी इंपॉर्टेंट रोल. इट बी योर स्किन, इट बी योर हेयर. आपका अच्छा खाना ज़रूरी है, आपका टाइमली सोना उठना, टू फॉलो द
And
क्लॉक ऑफ
सोचना जरूरी है, अच्छा सोचना. Remain positive. If you are a negative person, you develop hundreds of diseases. And most of the diseases in the skin, let me emphasize this fact, is they are all, or most of them, are stress related. How we think. So that is why the first thing, my advice to most of my patients is your attitude in life. If you've got a positive attitude, the treatment works better. So have a faith on the treatment, have a positive attitude, it will work better and you will get a good results.
So hyperpigmentation has also become a very big problem these days. तो कोई स्पेसिफिक रीजन है जो हाइपर पिगमेंटेशन डेवलप होता है? इज इट बिकॉज ऑफ द सन, बिकॉज ऑफ द स्ट्रेस जैसा आपने बोला, या कुछ ऐसा फैक्टर?
The commonest pigmentation we see nowadays, or even before also, by the way, okay, this is a long time, this is nothing new, is called melasma. छाइयाँ बोलते हैं जो,
हाँ, वो वाइट
जो ना बल्कि ब्लैक पैचेस. So यहाँ black patches cheeks पे बनते हैं, they come on the forehead also, they can come on the nose also. So generally they come with a hyperpigmentation, blackness in patches, and that is quite common. And generally it comes later. We don't see in the teenager and other things. So they are hormonal related. That there are certain special receptors are sitting in these areas. Why they become only pigmented? And obviously those receptors, they stimulate the cells which gives us color called melanocyte, and these melanocytes, when they get stimulated, they make it black. So this one is one factor, is the hormonal thing. That is why those who take more contraceptive pills, or after pregnancy, for example, when the hormones go up and down, so they develop more this facial pigmentation or melasma than others. But obviously men also develop. So don't think it is the only disease of the female, but the ratio is 9 to 1. So if the 9 women get this pigmentation, 1 man also get attacked, and they become more embarrassed because everybody knows it's a disease of the female, not the man. Oh my God, do something, doctor. So in other words, so this is a commonest one. Another disease I want to mention is which is we see predominantly in our Indian population, and we don't see in the West. I worked for many years. So this is called lichen planus pigmentosis. This is a inflammatory autoimmune disease. Some reason or the other, our Indian populations get affected. Females more than men. And in this one, the sun exposed area get involved. So that means the sun plays a role. So we also call it lichen planus actinicus. Actinicus means the sun related. So this is predominantly present on the exposed area, like on the face, on the V area of your distinct chest. Sometimes ears get involved, and they feel very upset because the degree of pigmentation can vary and make you really black. So the rest of the body is fine, but this becomes so, and they feel that everybody is commenting and they can't really go to the parties or even relatives because, it's a psychological torture for them. And this disease is difficult to treat, but we try our best. So that's common. Otherwise, as you mentioned, what are the other causes could be that what people use it on their face is called contact dermatitis. That some using the hair dye, for example, they develop the eczema on the dermatitis on the scalp, but then it trickle down on your face or the neck. They all swell up. So this is called post-inflammatory pigmentation. So because of the dermatitis, because of the inflammation, they develop all the pigmentation and blackness. And that's very common on the upper back, for example, as well as on the face. Another thing which we see much more common here is called cutaneous amyloidosis. Amyloid is a protein, and that protein get deposited in your skin because of the scratching, and that makes your skin black as well as itch. And that is very common on the arms as well as on the legs, or in the upper back. But sometimes if it is extensive, it even come up on your face and the neck, and that's again difficult to treat, but we do our best to help the patient as much as we can. So these are but there are loads of causes. The sun does play a role. So when we treat these patients, one of the in the list of the medication is the sunblock. So there are sunblock is the creams, but nowadays we have got systemic sunblocks also. So you can give the tablets to block the effect of the sun.
Okay.
And those who are too much sensitive, we have got medicine nowadays where we reduce or stop the photosensitivity. That people are too sensitive. Then they go out, they develop redness, they develop irritation, burning. So we have got a medication now to halt that process to help the patients. But sun is a very strong element from the pigmentation.
So as you said that हमारे पास सन ब्लॉकेज के लिए टैबलेट्स है, तो क्या उन टैबलेट्स के कोई साइड इफेक्ट भी होते हैं या दे आर कम्प्लीटली सेफ टू हैव?
देखो जी, nothing is safe. Let me start from this. If anybody says I can take it forever, answer is no. अगर शुगर लेंगे उसका भी साइड इफेक्ट है, सॉल्ट लेंगे उसका भी साइड इफेक्ट है, तो मेडिसिन कैसे सेफ हो सकती हैं? So doesn't matter what. So I'm straightforward saying no medicine is safe. Only thing is, then why we give it? We obviously monitor. We know what side effect this medicine can cause. And that is the difference. Those who know by giving the medicine what they are giving, or for those who just see and then prescribe. That's problem. So in other words, you do the testing. That's why you do the blood test. That's why you examine the patient. And when the patient, that's why do the follow-ups.
Right.
Otherwise, we'll say, okay, take this medicine all your life. We can't say that. So we have to see the patients to assess not only the condition of the patients, rather any side effect caused by the medicine we have given. Whether it's a topical, the creams वगैरह, or by systemic, the medicine you take.
Okay.
So in other words, there होते हैं जो side effect.
ऑल्सो वन मोर वेरी इंपॉर्टेंट फैक्टर जो आजकल थोड़ा ज़्यादा हो गया बिकॉज हमारा सन एक्सपोजर इतना बढ़ गया है प्लस पोल्यूशन एंड ऑल ऑफ दोज थिंग्स, पीपल आर डेवलपिंग स्किन कैंसर, डिफरेंट काइंड्स ऑफ कैंसर. तो स्किन कैंसर के सबसे पहले इफेक्ट्स या जब आपको दिखना शुरू होता है ना कि ओके दिस कैन बी कैंसरस, वो क्या ऐसे सिम्टम्स होते हैं जो एक इंसान की स्किन में आते हैं व्हेन ही और शी इज डेवलपिंग स्किन कैंसर, और किस पॉइंट तक डर्मेटोलॉजिस्ट को कंसल्ट करना बहुत इंपॉर्टेंट हो जाता है कि इसके बाद नथिंग कैन बी डन, आपको इससे पहले आना चाहिए था?
Number one, fortunately, God has given us enough melanin in our skin generally to give us protection from the sun damage effect on our skin. इसलिए I have been practicing here for a good few years, and I have practiced many years in the West also. I see hardly few patients with skin cancer in India. Even if most of us, they walk around quite a bit. Our agriculturists, our society is agriculturist, and they work in the fields, but they don't develop.
Right.
But in the West, when we practice, every fourth, fifth patient is with skin cancer. So imagine how much common it is there and how much uncommon it is here. And the only way, what you are asking me, how will you know it? The worrying type of cancer is called malignant melanoma. Malignant melanoma means that they are all black. So they are like a nevus, like a mole जो होते हैं ऐसे ही लगेंगे. Even in the ordinary mole, as long as they are asymptomatic, we don't bother. But I will suggest and recommend any mole in our system, body, if it suddenly increase in size और इरिटेबल हो जाए या उसके अंदर थोड़ा सा डिस्चार्ज या ब्लीडिंग आने लग जाती है और द इरेगुलर से लगने लग जाते हैं, देन इट इज़ वेरी इंपॉर्टेंट. यू आस्क मी व्हेन टू गो, rush to the dermatologist. We have got a dermatoscope also. We can see through the skin.
Okay.
So that we know कि this mole worrying type है कि नहीं है. So ordinary वो mole, we say it's a mole, forget about it. But अगर हमें उसके अंदर थोड़े से भी चेंजेस नजर आते हैं, we कहते हैं ये atypical nevus है. It's not typical, it's atypical, which has got more tendency to develop into skin cancer. And there are certain ones which develop into a melanoma that is a life-threatening. So that takes only months and years to, take away. It's so dangerous. And unfortunately then, in our society, in India for example, though malignant melanoma is not common as I said, but when it comes, it is called acral malignant melanoma. That means it is on the ending point of our body, like on the fingers,
Okay.
like on the toes. Sometimes we see it I have seen couple of them here in the groin area. So in other words, when they come in certain area, people ignore it. So they are late and they metastasize in your system. So when this malignant melanoma spread in your body, it is life-threatening. So in those circumstances, suggestion is any mole which becomes symptomatic, don't delay.
Rush to a dermatologist.
One must rush to your nearest dermatologist, whosoever you believe to, and let them examine you. And if it is doubtful, they do a skin biopsy, they take it out and look under microscope to confirm.
Okay.
And then take further action. But the commonest one, I'm just suggesting, not all are bad. One benign cancer, I use the word because it doesn't spread 99.9%, is called basal cell carcinoma or BCC. This is the commonest one, and that comes generally on the exposed area with a damaging effect of the sun, and they develop this kind of skin cancers, which we see sometimes. But I use the term that they are not, we have to reassure the patient that they are not dangerous. They don't really one of those cancer which kills the patients. They are the one who stays where they are, but like a rodent, they erode the skin. They go deeper, they can make ulceration, and if they are near the eye, for example, they can damage your eye also. So take advice at the earliest possible. Other one is because of the squamous cell carcinoma, we call it. And again, that is because of the sun damaging effect. And so whenever you are doubtful, anything which is growing on your skin is better to consult.
It's better to consult
That's it, rather than
being so
staying on
late, right?
and staying on it. Not a good idea.
Because that can be very dangerous and life threatening also, because
Correct.
it is not common in India, जैसा आपने बोला,
But
तो लोग उसको इग्नोर भी कर जाते हैं कभी कभी कि ओके मे बी जस्ट अ स्किन चेंज, मे बी आई हैव अप्लाइड समथिंग व्हिच इज रॉन्ग,
और
इसीलिए
जितना
itch हो
लंबा
रहा है.
छोड़ोगे अपने आप जाना नहीं है, एंड इट विल ओनली ग्रो बिगर. बढ़ाई तो होगा एंड इट हैज गॉट मोर प्रॉब्लम्स.
राइट. सो जिनकी स्किन बहुत संवेदनाशील होती है उनको आप क्या सजेस्ट करेंगे?
मतलब सेंसिटिव है.
हाँ.
फर्स्ट ऑफ ऑल रंग पे डिपेंड करता है.
लाइक फेयर स्किन
हाँ,
एंड
दैट्स इट.
सेंसिटिव.
अगर फेयर स्किन है और सेंसिटिव स्किन है तो द मोस्ट इम्पॉर्टेंट थिंग दे शुड डू इट सन प्रोटेक्शन. सन प्रोटेक्शन इज वेरी आइडियल. नंबर 2 डिपेंड करता है ड्राई स्किन है या ऑयली स्किन, एंड अकॉर्डिंगली टेक एक्शन. अगर ड्राई स्किन है तो मॉइस्चराइज़र ज़्यादा लगाने चाहिए. अगर ज़्यादा ऑयली स्किन है तो यूज़ सर्टन थिंग्स जिसमें कि ऑयली सेबेशियस ग्लैंड या ऑयली स्किन ज़्यादा काम ना करे. तो यू हैव टू रियली गो अकॉर्डिंगली एंड देन टेक एन एक्शन.
तो जैसे हमने सुना है कई बार, जैसे जिन लोगों की स्किन थोड़ी एक्ने प्रोन होती है या थोड़ी सी ऑयली होती है, उनको हम सजेस्ट करते हैं कि आप घी कट डाउन करो, बटर कट डाउन करो, यू कट डाउन दैट ऑयल थिंग इन योर डाइट. सो इज इट रियली हेल्पफुल कि ऑयल कट करने से आपका जो एक्ने है वो कम हो जाता है?
It does help because sebaceous glands are called oily glands. And if you take more oil in your system, they are likely to stimulate it. So and also the medicine nowadays we give, they are also oily glands को inflame करते हैं, तो we always suggest cut down.
और ड्राई स्किन में कुछ ऐसा इफेक्ट आता है, कुछ कट डाउन करना चाहिए या उनको ऑयल ज़्यादा लेना चाहिए मे बी?
ऑयल तो लेने को तो हम इतना नहीं करते हैं बिकॉज सीरम लिपिड्स माइट गो अप, बट ऑन द अदर हैंड लगाना तो चाहिए उनको. लोकल मॉइस्चराइजिंग लोशन शुड बी यूज्ड. Moisturizing lotions.
Any specific lotion for sensitive skin you can suggest?
There are 10 types of, I don't want to recommend to a company who will fight with me, but on the other hand, there are number of moisturizing lotions nowadays available. There are many this body wash are available, especially with the oat derived one,
right,
and they are wonderful.
मेरा यही क्वेश्चन था कि कुछ इंग्रेडिएंट जो उनको लेने से पहले.
ओट से बना हुआ सोप इज वेरी गुड. मॉइस्चराइजर्स जो हैं अवीनो का है. देयर आर मैनी एक्चुअली एंड दे आर वंडरफुल.
राइट. थैंक यू सो मच. दिस वाज क्वाइट नॉलेजेबल डिस्कशन और आई फील हमारी जिन्होंने सुना है उनको भी काफ़ी ये नॉलेजेबल लगा होगा. आपने इतनी नई डिजीजेज या इतने नई टाइप की चीज़ें आपने मेंशन करी यहाँ पे, एंड यू क्लियर्ड इट आउट सो वेल.
थैंक यू.
Thank you so much.
And thank you for your listeners also.
No, it was a great pleasure to have you here and to talk with you.
चलिए, thank you.
हमें फॉलो, शेयर व लाइक करना न भूलें और लेटेस्ट न्यूज अपडेट्स के लिए नोटिफिकेशन जरूर ऑन कर लें.